What's up, everyone? Today I'm going to be talking about the reasons you're not getting pregnant. This topic is actually so important to me because of the amount of times I've heard women or couples blaming themselves for why they've not gotten pregnant. So guys, this is a must-watch video because I'm going to be talking about all of the possible reasons you have not gotten pregnant yet. If you're new to this channel, I am Dr. Amarachi Ijeoma. I'm a fertility physician, and if you want more content on everything fertility, their solutions and causes, kindly subscribe to my channel, like this video, and drop a comment if you have questions. When we say a couple is infertile, we mean that they have been trying to get pregnant, but they've not been able to get pregnant even after regular unprotected sexual intercourse for at least 12 months. And sexual intercourse has to be between a penis and a vagina. By regular sexual intercourse, I mean that you should be having sex every 2 to 3 days. Now guys, this does not mean that you should start timing your sex, because if you're timing sexual intercourse, then you're removing all of the fun from it, and then you start to be, there's now anxiety, and then what you're trying to achieve, you won't be able to achieve. So my advice for you in this case is try and have sex as regular as possible and as natural as possible. So if you come to my clinic or any other clinic for that matter, and you tell them that you have been trying to conceive for 6 months, we wouldn't start any investigations for you until it is at least 12 months. However, there are some exceptions though. And these exceptions include women greater than 35 years old. So for women greater than 35 years old, they must have been having regular unprotected intercourse for at least 6 months. So if they've not been able to achieve the pregnancy within 6 months, they will start investigations. This is because they are already 35 years old, and the older they get, the lower the chances of actually getting pregnant naturally. We also make exceptions for women that have irregular cycles, so we can actually start investigations earlier, sooner than even 6 months. Also, for women that have been previously diagnosed with any gynecological disorder that can potentially affect fertility. One of the popular questions I get is, "Doctor, can I be infertile but I already have one child?" The answer is yes. This is actually called secondary infertility. That is the inability to actually get pregnant even after having 1 or 2 children. Primary infertility, on the other hand, means that you've never had at all and you've been trying for at least 12 months. So with a diagram, I'm going to be explaining how a baby is actually formed, from when you've had sex to when the sperm is going into the vagina to when the baby is formed totally, completely. This will help us understand at what junctions, at what points problems can actually arise that can prevent a couple from actually getting pregnant. So this is the female reproductive tract. Right here we have the womb of the woman. This is also called the uterus. And then the lower part of the uterus, which is the neck of the womb, is called the cervix. Now this is the vagina. And these are the ovaries. These are the fallopian tubes. Now, what happens when a couple has sex, and then how is this baby formed? When a couple has sex, the penis is here and then deposits sperm in the vagina within seconds. Now this sperm swims all the way here to the top of the womb and into the fallopian tubes within minutes. Now when a woman is ovulating, meaning that when she's releasing eggs, this is the ovary, she can release either 1 or 2 eggs. Now these eggs will go into the fallopian tube and then travel all the way to this place. Then when the sperm gets into the tubes, it meets the egg at this junction. Now fertilization will occur at this junction and a zygote will be formed. Now this zygote will travel all the way to the inside of the womb, the baby bed, within a few days, and then find a place on the wall of the womb to attach itself, and then this baby grows. Then during delivery, this cervix, the neck of the womb, opens up and the baby comes out. Now, this is just what happens when both the male and the female are fertile. But in a case when you've been trying to achieve pregnancy and you've not been able to get pregnant, the problems could be from the cervix, from the neck of the womb, from the structure, from the muscles of from the body of the womb, from the ovaries. It could be that the woman is not ovulating. From the tubes are blocked, then sperm cannot pass and get to this egg that is here. Or if the sperm itself is not enough, like if the sperm itself is not fast enough, maybe there's problem with the movement or the amount of sperm, then it will not also be getting to the egg. And also another problem can be from the brain, because it's the brain that controls everything that is going on in this organ. From what I just explained, it means that both the man and the woman can be responsible for infertility. So that being said, I'm going to start with the male causes of infertility. And the major cause is actually problem with the sperm. Now, when there's problem with the quantity or quality of the sperm, then this can also affect fertility in the man. Now, if the sperm count is low, there won't be enough sperm to swim all the way to the top of the womb and into the tubes. If the sperm count is slow, maybe there's a problem with the motility, it can't move fast, then the egg that is waiting in the tube is very impatient. It will not wait that long for the sperm to actually come and fertilize it. So if there is reduction in the movement, if there's slow motility, there's reduced motility, then that can be a problem, a cause of infertility in the man. Also, if the man has a problem with the shape of the sperm, because sperm has a particular shape that helps it swim really fast. So if this shape is distorted, then it will impede the movement of the sperm. So that is just the summary of male infertility. Now for the women, when you don't have enough eggs in your ovaries, because this sperm actually need eggs for fertilization to occur. So if you have very low ovarian reserve, then it can actually affect your chances of getting pregnant. Another reason is ovulation disorders. I mentioned that ovulation is the release of eggs from the ovary. So if there's a problem or any disease that you have that can affect the release of eggs from your ovaries, then the chances of getting pregnant will be reduced. And I'm going to be talking about some of these diseases that can actually affect ovulation. 1. PCOS, Polycystic Ovarian Syndrome. Some of you might have heard this. Some of you might have been diagnosed with it, but you don't understand why it is affecting your fertility. Why it affects your fertility is that it actually prevents ovulation. So it's not like you are not ovulating at all, but maybe in a year you are ovulating 3 to 4 times. You understand? So it prevents like regular ovulation, and this reduces your chances of actually getting pregnant. However, this does not mean that if you have PCOS, you cannot get pregnant though. No, you can still get pregnant because you still ovulate, but you just don't ovulate regularly. Because PCOS when you have PCOS, then you have irregular menstrual cycle. And then, like I explained, it can cause anovulation. Another cause of another disease that can actually affect ovulation, that can actually cause you to not release eggs normally, is hyperprolactinemia. Now, let me break it down for you. Some women complain that they have breast discharge. Doctor, there's milk coming out from my breast and I'm not breastfeeding. I haven't given birth. Now, this is called hyperprolactinemia, and it affects ovulation. So when you're having milk coming out from your breasts, or all those watery-like discharge from your breast, it can prevent ovulation. It can prevent you from releasing eggs from your ovaries. Another disease that can affect ovulation is hypothyroidism. Now, hypothyroidism is problems with the thyroid, an organ that is here. Now, when you have problems with the thyroid, it can also affect ovulation. Another one is stress. Now, when you are too stressed, for example, maybe you are dieting, but you are doing this extreme diet that even when you eat, you put your hand in your mouth and throw it out. Or you are over dieting to the extent that you're losing so much weight, and then your weight now becomes too small for your height. That is, your BMI, your body mass index, is reduced. Or in a case where you're having a disease for a long time, or you're having this lifestyle stress, it can prevent you from menstruating. And if you don't menstruate, if you don't see your period, then you don't ovulate. And if you don't ovulate, pregnancy cannot occur. This next cause I want to talk about is extremely important to me because of the amount of times I've heard women say that, but doctor, I've treated infection. But doctor, I don't have infection. Why am I not pregnant? Now, how infection can actually cause infertility is that sometimes this infection, when you have sex, the penis can introduce it all the way up into the pelvis, and then it can cause pelvic inflammatory disease. Or you've not treated the infection for a while and you've had it for a long time, or you treated it and it's not properly treated. This can lead to PID, and when it's up in the reproductive organ, when it's up in the womb, it can actually cause adhesions. It can cause scarring of the tubes. And now these adhesions just mean that, for example, the tube, fallopian tube, is a hollow organ, like there's space. It's like a pipe that has a hole. Now when this pipe now fuses together and water or something cannot pass through it, it means that adhesions are there that made it fuse together. Now, once the fallopian tubes, which is a hollow organ, is affected, once these infections have damaged the tubes, then the tubes will now be fused together and sperm cannot swim and get to the egg. So it's not all about you have infection. Did you treat the infection? How did you treat the infection? So these things are important because infection, sexually transmitted infections like chlamydia and gonorrhea, can cause scarring, can cause blockage of the fallopian tubes. And like I said, once there's blockage, then the sperm cannot meet the egg for fertilization to occur, and this will prevent pregnancy. Adhesions can also be as a result of a condition called endometriosis. Now, some of you might have heard this particular word, endometriosis. It just means that the lining of the inside of the womb, where the baby is supposed to be staying, is found in other parts of the body, or mostly other areas in your pelvis. So this can also damage the tube. It can cause adhesions. Even it can also cause adhesions on the baby bed and prevent the sperm from meeting the egg and cause infertility. Another cause can be fibroid. Now, this is where a lot of people make mistakes. Fibroid is not a death sentence. Fibroid is just simply means like a growth on the muscle of the womb. Now, it's not all fibroids that cause infertility now. Some fibroids are just there. If it's not affecting you, leave it alone. It only causes infertility when it is on the baby bed. Because there are different locations. Fibroid can be on the outer part of the womb. in the muscle of the womb or on the baby bed. Now, when it's on the baby bed, it can cause infertility by maybe you can even get pregnant with it. It's just that when you get pregnant, this fibroid now be competing for space with the baby, and it can lead to miscarriage. It can lead to uterine fetal death, that is, baby will die while it's still in the womb. It can lead to all of those complications. Also, if this fibroid is greater than a particular size, and then it's now giving you symptoms like excessive bleeding or excessive pain and bleeding while menstruating, then it can potentially affect fertility. Another cause can be maybe you've done surgeries in the past on your pelvis, on your lower abdomen. It can lead to complications like adhesions that will also prevent fertility. You might be wondering what type of surgery. It could be surgeries, maybe you've done a previous removal of fibroid, myomectomy, or maybe a previous CS, or any surgery that you do on your pelvis. A complication can be adhesions that can prevent you from actually getting pregnant. Another cause can be a growth on your cervix, the neck of your womb, called polyp. Now, this polyp can even cover the whole, like there's this hole that the baby comes out from in the neck of the womb. Now, this polyp can grow and then cover that hole. And if it covers it, how does sperm even swim all the way up to get to the egg? And then research has also shown that polyp actually affects fertility. But if after both you and your partner have done all the standard infertility tests and there was no cause of infertility, for example, you've done HSG, hysterosalpingogram, and your tubes are fine. You've done ultrasound scan and your womb is fine. You've checked your thyroid and it is fine. You are sure you are ovulating. You've done the test to check if you still have eggs. Your ovarian reserve is fine, and then it is fine. Then we will diagnose you as unexplained infertility. This is actually a thing. Unexplained infertility. This means that both the man and the woman have undergone all the standard infertility tests and no cause was found. So that was just a summary of the causes of infertility in men and women. One, prenatal vitamins. As a woman, when you're trying to get pregnant, when you're on the journey to get pregnant, one of the things that I would advise you to take are prenatal vitamins. Now, it's not like these vitamins will remove all of the causes of infertility or it will put the baby in your tummy. No. It's just that these vitamins, you should buy the one that contains folic acid. Why I'm saying this is because folic acid helps to prevent neural tube defect in your baby. That's when you finally get pregnant. Folic acid is also called folate. So when you buy any multivitamins, because I'm well aware that everywhere women are buying multivitamins to get pregnant. So while you're buying that multivitamins, because I'm not going to call any brand, while you're buying it, please just check the bottle. Did they write folic acid there or folate as part of the ingredient? If they did, buy it. I'm not saying that the folic acid helps to increase your chances of getting pregnant. Well, there are some studies that say that, but there's no conclusion. The major function is that it will prevent neural tube defect. This is a disorder. It will prevent neural tube defect in your baby. Now, on the container of that multivitamins, make sure that they wrote 400 micrograms of L-methylfolate. This is very important. Another ingredient you should look out for is DHA. DHA helps with the development of the brain of that baby that is in your womb. So when buying your next multivitamin to get pregnant, when buying your next prenatal multivitamins, please check for these two ingredients, folic acid or folate and DHA. Another one is have a normal weight for your height. This means that you should maintain a healthy weight because it gives you a higher chance of actually getting pregnant. Well, I'm not saying that if you're overweight or if you're obese, you can never get pregnant. No, that's not what I'm saying. But what I'm saying is when trying to get pregnant, to optimize your chances, to increase your chances, maintain a normal body weight. Because studies have shown that when you're overweight or underweight, it can actually affect your chances of getting pregnant. Another one is have sex within your fertile window. And I've explained this in a previous video that you should have sex 5 days to your ovulation or on the day of your ovulation. This gives you a higher chance of actually conceiving. Some of you need assistance when having sex, so you tend to buy some lubricants like oil-based or water-based lubricants that actually makes the sex easier and more pleasurable. But one thing you should know about some of these lubricants that you buy, for example, KY jelly. When you're trying to get pregnant, please avoid KY jelly because it actually lets the sperm die faster, and it also reduces motility. That is, it reduces the speed with which the sperm swims all the way to the tubes. So if you must use a lubricant while having sex, please check the bottle of the lubricant. Make sure that it contains hydroxyl ethyl cellulose. This one is more sperm friendly and it will actually not kill the sperm. It will allow the sperm die faster. Avoid smoking, guys. A lot of studies have shown that these smoking affects the quality of eggs. Smoking affects the quality of sperm. Smoking affects both the male and the female. It can actually cause infertility in both male and female. So when trying to get pregnant, please avoid smoking. Same with caffeine. Avoid caffeine. When you take too much caffeine, it can actually increase your chance of getting miscarriage, of having miscarriage. You might want to ask, how much is too much? Well, when you take over 5 cups of caffeine in a day, it's too much caffeine, and this can actually affect fertility. Now guys, if you enjoyed this video, if you found it informative and you want more content like this, subscribe to my channel, click the notification bell below and like this video.